Good afternoon everyone, it's Dr. McQuillan from Berkshire Menopause Clinic, and today I'm going to be talking through how to use your estradiol patches that have been prescribed to you as part of HRT. So let's get started. So there are different types of patches. You can get combined patches which contain both estrogen and progestogens, and you can get estrogen only patches. When you're having combined patches, you may have continuous combined, and this will be if you're menopausal and not having periods, in which case the estrogen and progestogen will be the same patch throughout the whole month. You may be having sequential, and that means for half the month you will be taking progestogen, which means that for half the month you will have a patch containing both estrogen and progestogens, and for half the month just estrogen. So please be really careful. It's really important you read your packets and ensure that you are doing both, because what you don't want to do is be doubling up on the estrogen only and then not getting the protection for your womb lining. So let's start and show you how you use your patches. So an estrogen patch is what we call a transdermal preparation. You apply it through the skin. It mimics your natural estrogen, and it's one of the more natural forms of estradiol in terms of your HRT. So I have my trusty patch here. Now what I tell people is put it wherever you find comfortable. I tend to say put it on your lower body away from the breast tissue, but also a tip maybe to put it on your bottom. So where you might find a jeans pocket right in the middle of your bottom, that's where I advise women to put it. The reason being is if you put it on your thigh or your lower tummy, you might find that it rubs off because you're constantly, if you're going to the toilet or taking your trousers and your pants down, then it often will just peel off. Even if a little bit of the corner peels off, you may not be getting that absorption of the full amount of the medication as you need. So take it, put it on your bottom. The other tip I have, because a lot of women find that they get it peeling off eventually within the 3-4 days. So warm it up. So I'm just going to demonstrate on my hand what to do. So we peel it off, we put it on our hand, and then I'm going to rub it in. Now, what can be helpful to try and avoid it coming off is rub it for 20 to 30 seconds. What this does, by warming the glue up, it makes the glue absorb and stick better. So you might find that's a helpful tip. So remember, I'm doing it on my hand, but do it on your bottom. Now you may be thinking, what has she got here? This is a hairdryer. That's another one of my tips. If you feel that your skin is wet and not nice and dry, maybe you've had a shower, make sure you dry it really well. Sometimes there's a bit of absorption left. Some people find just rubbing it for 20-30 seconds doesn't do it, and that's where a hairdryer can come in. So just again, making sure you don't burn your skin, but just drying it for 20 seconds, making it really warm and dry can make the glue stick better. If you find that they still don't stick better, it may be useful to try a different preparation. The other thing a lot of women find is irritation. If you're getting local irritation, again, you might want to try and find a different brand. Or another tip of mine, which will need a prescription, is using the same spray that asthmatics use, which is a steroid inhaler spray. Not a steroid cream, because using a cream will be greasy and it means that it will peel off. But what a steroid inhaler spray does is the steroid in it can reduce inflammation, but because it's a spray, it dries quickly, and then when you put the patch, it doesn't come off. So if that does happen, there are lots of different ways we can try and get around it. To seek help from your menopause specialist to try and work through those issues. I hope that helps.